My name is Amanda Jones. I'm going to do an assessment of the peripheral vascular system. But before I do that, I would like to ask you a couple questions. Are you having any leg cramps or swelling in your legs?
No.
Any pain or numbness or tingling to your arms or legs?
No.
And are you on any medications for swelling?
No.
Okay. The first thing that I'd like to do is take a look at both of your hands. And I'm just going to look at both of them, check for any scars, which you don't have any, check for the temperature and they're warm to the touch. Also going to just check the sensation in them. While I'm doing that, I'm going to check for clubbing in your fingers, and in order to do that, I'm going to look at the side, look at your finger from the side view, and your fingers look normal on that hand and normal on that hand, so there's no clubbing present. I'm also going to check your capillary refill in both of your hands. In order to do that, I'm going to compress your finger in your nail bed and release it. Watch the color come back. Normal would be less than 1 to 2 seconds, and you're normal in that hand. Check it on the other side now. That side is also normal. Next, I'm going to check your radial pulses, and it's important to check those both at the same time. And your pulses are 2+ palpable, which is normal, and they're equal rate and rhythm on both sides, which is good because you want them to be the same. The next thing that I'm going to do is check your brachial pulses. I want you to just open up both arms. We're just going to feel on the inside at the same time. And those are equal bilaterally. The next thing that I want you to do is I want you to shake my hand with one hand, and while you're doing that, I'm going to feel underneath for your epitrochlear lymph nodes, and that should not be felt in someone who does not have any issues with their lymph nodes, and yours are normal. The last thing that I'm going to do is I'm going to have you give me one arm, and we're going to turn it over, and I'm going to compress your ulnar and your radial artery, and I want you to just open and close your hand multiple times. You'll notice how your hand's getting white. Keep doing it. And then I'll release your ulnar artery, and we're going to check and see how long it takes for the color to come back in your hand. And we'll do that one more time. And stop. And yours comes back normally. Let's check the other side. One more time. And the blood refills well, so that's good. Next, I'm going to have you lay down. Lay that way. Lay that way. And I'm just going to take a look at your lower extremities. They look normal in size, bilaterally. They're both warm to the touch. No swelling is noted. I'm going to check your pulses in 4 different areas: your femoral, your popliteal, your posterior tibial, and your dorsalis pedis. And we're just going to make sure that they're equal on both sides. So we're going to check your pulses in your femoral, and those are equal. And oftentimes it's difficult to find the pulse in the normal person who's not having any issues in their knees. And actually, I feel reverse, so that's good. If you're unable to feel them, another thing that you can have your patient do is turn over onto their stomach, which you don't have to do, and have them bend their knee up, and sometimes you can feel it that way. But those are both normal. I'm going to feel your dorsalis pedis, which is right on the top of your foot. those are equal and normal. And then I'm going to feel just right inside the inside of your ankle. Those are also normal. And your temperature in your legs is normal all the way down. The next thing that I'm going to do is I'm going to just measure your legs on both sides. And you would do this in a patient that you thought potentially might have a blood clot in one of their legs. So one of the things you do is you just measure from the largest point. So I'm just going to have you bend your leg up a little bit like this. And we're just going to measure on this side, and you measure from the largest point of the leg. And you always measure in centimeters. So that one's 39 centimeters. And then measure this one. And that one's also 39 centimeters. Another thing that you can do to assess for blood clot in someone's leg is I'm going to have you just kind of lift your leg up kind of like this and just kind of compress back here on your calf muscle. And do you have any tenderness or pain there?
No.
No? Okay. And then what about if I take your foot and push it back like this? Do you have any pain
No.
there? Okay, so you would have a negative Homan sign. Let's check this leg. Any pain when I push like that?
No.
Any pain when pushing like that?
No.
Okay. So you can relax that. And then the last thing that you would do is if you have a patient who's got any kind of varicose veins, you would have them stand up and you would measure from here to the bottom of the leg, which you don't have any varicose veins, so that's fine, we don't have to do that. Another thing that I'm going to check for is just the blood flow in your legs. So what you're going to do is you're going to lift your legs off of the couch in just a minute, and you'll do it for like 30 seconds. You'll just kind of make them go back and forth and hang them just to kind of get the blood flow out of the bottom of your legs, and then you'll sit up and you'll dangle, and we'll just assess as to how long it takes for the blood flow to go back into your legs. So do that for a few seconds. And you can kind of see a little bit of the color change from the blood coming out of your feet. Okay. And then I want you to sit up and kind of dangle them and just watch the flow go back in. Alright, and that looks pretty normal. And that is an assessment of the peripheral vascular system.